Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today in Neighborhood Health Watch, we're talking about ventral hernias. They seemingly can occur almost anywhere in your abdominal wall. These type of hernias can occur at your belly button, in the midline between the breastbone and belly button, or also inside an old incision. Ventral hernias can become symptomatic and grow to be very large. Dr. Amy Rose with Chippenham Johnston Willis Hospital is here to tell us more. Now, this is such a common problem. How do hernias form in the first place?
Well, the hernias can form in lots of different ways. Sometimes people can be born with them, particularly ones at the belly button, or they can occur with anything that increases pressure inside the abdomen. So we think typically about lifting, but it can also be pushing or pulling, anything particularly heavy. Also, the things we don't think about, though, are people who have severe constipation and strain when they have bowel movements, people who have chronic coughs and increase their pressure that way.
So those are some of the symptoms, the coughing. What are the symptoms, I guess would be the better question.
So symptoms are typically more pain. So people will notice an area on their abdominal wall that's uncomfortable or that has a bulge. Often the bulge is present, but not always. Sometimes people can't actually feel the bulge, we'll just have the hole. Realize a hernia is the actual hole. What you feel as the bulge is what's protruding through the hole that's actually supposed to be inside the abdomen.
And how important is it to have it repaired or removed?
Well, repaired, because again, you're patching a hole is what you're doing when you repair it. And it depends on where it is and the size. If it's a small hernia at the belly button that's not bothering somebody at all and it's not getting bigger, then that actually doesn't need to be repaired. If it's getting larger, then it does need to be fixed, or if it's causing symptoms, it needs to be fixed. Because if it's enlarging, it has the potential to get to a size that the intestine can protrude through the hole and potentially get caught and stuck.
And what are some of the options that a patient might have?
So there are several, depending on the size of the hernia. What we would call an open approach, which is where we make an incision on the outside, push the contents back into the belly where it's supposed to be and patch it from the outside, or a laparoscopic repair, and that can be traditional laparoscopy or robotics, and there are advantages and disadvantages to each, but it's still just laparoscopy.
But it shouldn't be ignored, that's the bottom line.
It should not be ignored. Unless it's a small umbilical hernia that's completely asymptomatic, it should not be ignored.
All right. Dr. Amy Rose joining us on First at 4 with some valuable information. Thank you so much.